Hi. We are just going to talk about this patient's ECG particularly. If we see the clinical things of this patient is a newly detected hypertensive. She is not already hypertensive, a 47 years female. She had giddiness, she has headache, both the symptoms actually. ECG is quite interesting of this female, and that's why actually I'm just recording this session, and I'll be teaching you about that particular ECG. So if we see her clinical, after clinical profile, we'll go to her reports and we'll just find out the ECG. Look at this ECG. I'll just explain you a couple of things about this ECG. If you can look into the ECG very carefully, what you will find, so you will find this P wave is inverted in lead 3. You will have this P wave inverted in lead 3 now, and then P is followed by the QRS complex. So basically this is sinus rhythm. This is sinus rhythm, no doubt in that. But the P, as P wave is becoming inverted in lead 3, it can be ectopic. The origin of the P P wave or that stimulus may be from somewhere else. That is one of the observation. If you find the P wave in lead 1, you are finding it in a positive, so positive P wave. Fine. So this is one of the observation over here, and another very important observation. If you see the interval between the RR complex, you always have to look for the lead 2 and it is called as a rhythm strip. So whenever ECG is being recorded, you have all other leads above there, but lead 2 will be a long lead. So this is called as a rhythm strip actually, or long lead, and into this we'll have to see the rhythms. If you find out you have the interval between this RR in between 2 as a almost constant, you see in this complex you are getting this one complex as early than the other ones. So this can be a sinus arrhythmia. This can be. But later, if you find there is no T wave for this and there is a pause over here, so this is a kind of arrhythmia for this. Probably I'll involve some of my other colleagues also to comment on this ECG. But this is what actually you will find primarily at your particular stage, that you are finding this particular complex and this complex are different than other complexes, and it is coming earlier. So this is a kind of arrhythmia the patient is suffering from, and we should start her on beta blockers for this. Now if we if you have seen the patient is giving history of giddiness, then we'll have to find out whether she is suffering from any other arrhythmia as well to have giddiness or syncopal kind of things. So this is quite interesting case and interesting ECG to look upon, and this patient should be started on beta blockers, what I feel, and then observe her for her giddiness or syncope as well. So this is what for the patient for time being. Thank you.